So welcome, everyone. Welcome. Please do come into the room. You are at the panel discussion for this afternoon, hosted by the National Hispanic Latino Addiction Technology Transfer Center and also for the Prevention Technology Transfer Center. So welcome. So we're about 2 minutes after the top of the hour, and we have a lot of content and information to provide to you. So I'm going to go ahead and get started. So welcome everyone who is here today for our panel discussion with our esteemed speakers. My name is Dr. Susie Villalobos. I am the current project director for the National Hispanic and Latino ATTC and the National Hispanic and Latino PTTC. Welcome everyone to our panel discussion, Unmasking the Crisis, Exploring Intentional Substance Use Overdoses among the Hispanic and Latino population. We will be understanding the factors, talking about addressing the crisis and promoting resilience among our Hispanic and Latino communities. Our esteemed speakers and panelists for today are Dr. Cristina Rabadán-Deal, Dr. Fernando Gonzalez, and Dr. Rocky Romero. I'd also like to thank some of the staff that is here today from both the ATTC and the PTTC, Cristina Masivo Torres from the PTTC, Ana Chavez Mancias from the ATTC, and I believe also Elizabeth Rodriguez is here from the PTTC. So thank you for being here and putting this webinar together. Before we begin, we're just going to go through a couple of housekeeping. Today's presentation is sponsored by 2 cooperative agreements from the Substance Abuse and Mental Health Services Administration for both the ATTC and the PTTC. Today's panel discussion, we allow you to go ahead and raise your hand if at any time you have a question. We also allow for a chat function in our Zoom. And I believe you do have the Spanish closed captioning available. You can change that language at the bottom of your screen. Please also remember, it's very important that you complete our evaluation form so that we can continue to provide these types of free webinars with this important information. And you will receive a certificate of completion upon completing the evaluation. So for today's panel discussion, you will be understanding the impact of opioids among the Hispanic and Latino adults in the United States. We'll recognize the signs and symptoms of suicide intentionality. We'll learn some suicide prevention strategies, how community-based interventions can be the key to prevention and intervention, and understanding some of the challenges for our Hispanic and Latino families with a family member who experiences a substance use disorder. So I'm going to hand it over to our esteemed co-director for the National Hispanic and Latino Addiction Technology Transfer Center, our own Ana L. Chavez Mancias. Ana, I'm going to hand it over to you and stop sharing my screen.
Thank you, Dr. Villalobos. Before we get started, I have been tasked with the privilege and honor to introduce our panelists today. It is always a great pleasure to do this with these folks. Dr. Cristina Rabadán-Deal, after 25 years at the National Institute of Health and the Department of Health and Human Services, Dr. Rabadán-Deal joined WestEd in 2018, supporting clinical research programs, a multidisciplinary scientist with extensive experience in chronic non-communicable disease and global health. Dr. Rabadán-Deal currently serves as a subject matter expert and advisor in substance use disorder and works with governments, non-government organizations, and civil society. Dr. Fernando Gonzalez has more than 37 years of experience managing public health programs and projects in the United States, Mexico, US border, and global South countries. He currently serves as the manager for the EMS, Opioid Rapid Response and Prevention Program, UT Health Sciences Center in San Antonio, Project Vida in El Paso, Texas. And last but not least, Dr. Rocky Romero. He is the owner and CEO of J.R. Romero and Associates. Dr. Romero has been a pioneer in the development, evaluation, and consultation of behavioral health programs for 22 years. He's a former assistant professor at the New Mexico Highlands University School of Social Work in Albuquerque, New Mexico. Dr. Romero has an extensive academic background in social work. In addition, He was a member of the Governor Richardson's Higher Education Cultural Competency Task Force. So I want to welcome our presenters today, and we're super excited to have them. So I'm going to go ahead and I'm going to share my slides, and we will start with Dr. Gonzalez.
Thank you all. Good morning, good afternoon. Thank you, NALVA, ATTC, PTTC for having us, and honor and a pleasure to share this webinar with Dr. Ravadan and Dr. Romero. Thank you all for supporting this. It is my pleasure to start this webinar with an overview of some background information of the epidemic that we are living, statistical data related to Hispanic population, and they will be concluding my presentation, and then my colleagues will continue this activity. So if we can go to the next slide. Before we set a definition for substance use disorders, I would like to talk a little bit on the background of this public health crisis that we're living with, a real epidemic event going on. All of this was first noticed, or not first noticed, but first explained and sent to the public in the early 90s with the first wave of the epidemic, when prescription opioids and opioid combination was the rule for pain relief in treatment in the United States. Then the second wave in around 2010, in which because of stronger control of opioids, prescribed opioids, heroin appeared. So from in only 1 year, 2002 to 2003, overdose deaths because of heroin increased almost 300%. Then the third wave is the one that we're living now, and this is this monster that we are dealing daily with the fentanyl and the synthetic opioids appearance. So let's go ahead and review this definition of substance use disorders, that these disorders are treatable. We need to understand that they are treatable, maybe not curable, but they're treatable. Chronic diseases, this is a must, and we need to think always substance use disorders are chronic diseases, characterized by a problematic pattern of use of substance and substances, leading to impairment of health, social function, and mostly control over the substance use. This is a cluster of cognitive, behavioral, and physiological symptoms indicated that the individual, even though they want to stop, they cannot stop. And everybody knows the harmful consequences for discontinue because of the severe levels of addiction that grows and grows and grows. Next, please. The truth of substance use disorders in racial and ethnic populations and historical marginalized may experience substance use disorders and access to treatment quite differently than other populations. And later, when we are discussing some data that I will be presenting, we'll find out the differences of behavior of the substance use disorders in the community. 2020, the excellent national survey on drug abuse that goes on a yearly basis found that 12%, almost 13% of Hispanic people 12 and older, meaning 6.2 million people, had substance use disorders. So here are the big numbers, and later on will be the millions of people that are being affected by this. And a big issue, and I'm sure we'll be reviewing this factors later on. 95% of this cases, 12 and older, need of treatment in a special facility, of course, didn't receive such specialty care. And so this is a big issue when providing services, planning strategies, and other protective factors that are needed to control and decrease the impact in society of substance use disorders. Next, please. This is a big issue, and I think that in another presentation, my colleague and friend, Dr. Ramadan, bring this to my attention, and I appreciate that, because heroin is in use in the Hispanic population. In 2018, 1.7 million Hispanics, meaning 10.3 million people nationally, aged 12 and older, were estimated to have engaged with opioid misuse. But now, we'll be moving later on to the specific of heroin, and a higher percentage of Hispanic, and this is critical, a higher percentage of Hispanic 8th and 10th grades reported heroin and prescription substances misuse in the past year, meaning maybe 2018, 2017. More than whites and African Americans. So this is the next generation. This is the current youth population that are getting involved with hard drugs, if I may, like heroin. Next, please. And you will find in the red bar is 15.7 Hispanics that are using that are involved in substance use usage in the past year, and are distributed by racial and ethnic groups among people aged and 12. Only Asian population is less than the rest. Hispanic, second place, and that you go up until you find the American Indians and Alaska Natives. Next. And now let's go back to pain reliever usage in Hispanic population, and added the heroin use. So if you take a look in the right side of this circle, you will find 73,000 Hispanic people with pain reliever misuse and heroin use. Below, on the right corner, 76,000 Hispanic people with heroin use only. This will give us a total of 100, almost 150,000 Hispanic people using heroin. So, you know, this is a red flag in substance usage, because heroin is a very dangerous, powerful substance that can be deadly, as all of them. But heroin has been for a long time present in our communities, and you know, the numbers are growing in heroin usage in the United States. Next. Then you can see the distribution of substance use and mental diseases associated. For the upper left corner, 4.1 million Hispanic adults had substance use disorder, but not any mental illness. Okay, then the 3.1 with substance use and any mental illness, without severe mental illness. And you can go ahead and move to the distribution. Going right, 5.8 Hispanic adults had any mental illness without severe, but not substance use disorder. So this distribution gives us the idea on how to structure and planning interventions in that community if we have a clear idea on what's the behavior of these situations in our community. Next, please. And I think this is the last one, but let me tell you that what is alarming in my community in El Paso, Texas, mortality has increased 52% in the past 4 years, from 2018, 19, 20, 21, 4 years, increased from 88 deaths to 160, 52%. And this is the same pattern that many other communities across the nation are having. In El Paso, we have close to 80% of Hispanic population. So of course, you know, the numbers affect mostly Hispanic population. Also, we have suburban communities and some rural areas. But the numbers, you know, and as well as the prevalence and incidence of substance use disorders and mental health associated are growing tremendously. And finally, I would like to remember you, and this is going to be presented in extended discussion later on. It's about stigma. Stigma is the other epidemic going on. And if you add substance use disorders, mental illnesses, stigma, and also high prevalent clinical conditions like diabetes, high blood pressure, overweight, and infectious diseases associated to these conditions like hepatitis C, HIV, this becomes even harder to bring services appropriate for type of population and for the specific diseases that are in association doing great harm to the individual and the surrounding environment they have. Thank you.
Thank you so much, Dr. Gonzalez. We will move on next to our next panelist, Dr. Rocky Romero.
All right, thank you so much, Dr. Gonzalez, for that introduction. And it's my pleasure and honor to present with not only Dr. Gonzalez, but of course, Dr. Ravadan Deal. In terms of, I think we're kind of each bringing a really unique perspective in terms of Dr. Gonzalez laying the epidemiological view of suicide and substance use disorder. I'm going to kind of take a little bit of a step back and look at it from, of course, all of us are involved in different levels from the micro to the macro, meso included. But I want to kind of take a look at this from the prevention, intervention, and treatment aspects of looking at you know, what we're here to talk about today, intentional substance use disorder, overdoses, obviously with the Hispanic, Latinx population. So one of the things that we have to really understand, I believe, is that if we were to truly know how many individuals intentionally use substances to a point of taking their life through a suicidal means or a lethal means, the numbers would be much higher than they already are, right? The disparities would be even more glaring. And I think that's what we have to really think about. The numbers that were presented now and that will be presented to you later really encourage us to, one, study the quantitative data in order for us to connect to the qualitative experience, meaning that we have to look at these numbers that were presented by Dr. Gonzalez in terms of what are the meaning and the meat that goes along with this framework of what people are reporting to us, right, in terms of clinical care. So one of the things that we have to really try to do, and I'm going to talk more kind of concrete strategies in terms of prevention, intervention, and treatment. We have to look at getting gun safes and locks in people's homes more readily. There's a lot of funding available. I know AFSP, the American Foundation for Suicide Prevention, is doing a tremendous amount of efforts in terms of that including getting people aware of 988, right? The National Mental Health Crisis Line. So getting that into the hands of our Latinos, Latinx. For me, I kind of speak from this from a more kind of gendered experience in terms of males experiencing suicidal ideation, as well as the comorbidity of substance use disorder. So what I think we also have to do around the prevention end is really look at this through a multimedia prevention campaign, right? Using and utilizing multimedia strategies. I come to you from Albuquerque, New Mexico, right down the street from Dr. Gonzalez. And here in New Mexico, given the ruralness nature of our state, we also have to leverage social media in order to reduce the stigma that Dr. Gonzalez mentioned, right? That we all know a lot of our males and females have these cultural elements that they deal with given their experience with Latino culture, with their immigration journey, etc., to where they have to be really in a position to trust the providers that they're connecting with, or that we're trying to connect with them. So I think school-based engagement is an extremely important aspect of this, right? Where we talk about school-based mental health clinics and getting prevention in the school sooner, talking about suicide. Many of the schools in New Mexico that we've tried to intervene with originally, and this was started 10 years ago, really this thought initially, we don't have a suicide problem, we don't have a substance use problem. Yet obviously now data and it's in black and white, it doesn't lie, right? So now there's evidence to show that this is really the case. One study that I really draw a lot on, especially with New Mexico specific approaches, is the Youth Risk and Resiliency Survey. And that study is a national study through the Youth Risk and Resiliency aspect, but we look at it through New Mexico, and Latino males are reporting feelings of hopelessness, feelings of being unsafe in schools, feelings of sadness. That, coupled with access to opioids, to fentanyl, and to these really potent substances, with the volatility of their emotional deregulation as well, increases the possibility of obviously someone taking their life, right? Intentionally or again unintentionally through substance use. So I think that we really have to do a really good job. I know that AFSP is really doing a national push at the policy level to ask also for increased awareness and school-based mental health programs to intervene with these populations in a more direct manner. In New Mexico, we recently created through the Department of Health Suicide Stop It, which is a multimedia suicide campaign. And if you go to suicidestopit.com, you'll see a multi-pronged approach to a multimedia prevention strategy that we've implemented that's based on the CDC framework, looking at communities and preventative strategies for suicide. So that's kind of where we really drew a lot of our framework from. Now on the intervention side, I've really been talking a lot about addressing the cultural element of machismo within families, and looking at that as a double-edged sword, right? That on one end, machismo can be a noble person, a gentleman, someone that is very family oriented, very hardworking. Yet many times what we get in the media, and if you just do a Google search of machismo, you'd be surprised at the different images that you see from Latino gang members getting in trouble and presented in a very violent sort of framework. And that's a lot of what we see within the media, right? Within movies that we see on TV, the machismo kind of label then depicts somebody that is very aggressive and almost violent or criminal in nature when you look at the discourse surrounding machismo. Now, we can also look at machismo, like I said, as both risk and protective factors, right? If we highlight, and some researchers, I'm not the first to examine this a little bit more closely, but have really examined and uncovered the term and done some research in caballerismo, right? Creating more of a Latino gentleman in terms of somebody that is very family oriented. And in many respects, it's to counter the discourse that has labeled the machismo individual, Latino male, as violent, as criminal, as a threat, right? So that I think can help with that. In intervention, the second strategy that I think is extremely important with our young males is role identification. Unfortunately, many of the individuals that we see struggling with substance use disorder, as well as suicidal ideation or depression, we also see them in many, unfortunately, single parent households, right? Where father may be absent or immigrated, or there's a separation that happened along that immigration journey. And many times the young Latino steps up into that role almost as if they are the leader of the household, right? And to me, that exacerbates that role of machismo even further, to where it creates family conflicts and dynamics that can be very violent and very disruptive to family communication. And then the last part of intervention, as you all know, and I think it's just important to reiterate this: any intervention that we apply to Latinos and the Latino culture must be culturally adapted. And we have to embed within that cultural elements of respeto, familismo, while addressing the role of machismo, like I mentioned, in terms of what are these roles and how do you define this within your own family, and how is that impacting your relationship currently within the family structure and more within the community as well, in terms of substance use, access, etc. And then the last piece that I'm going to touch on is the treatment aspect, which, as you all know, any model that you're implementing with Latino culture across the country, unless that evidence-based model or best practice was researched and fine-tuned within a Latino population, we have to then culturally adapt those, right? We have to culturally adapt those to be appropriate for our populations. And that takes time. And the National Latino Behavioral Health Association, as well as the ATTC and PTTC, are experts in technical advising agencies and community-based programs how to culturally adapt your models to make them more culturally appropriate. The last two pieces that I'll touch on, and then I'll turn it over to our colleague who's going to share her last information here with us before we go to questions, is we have to speak their language, right? And when I say language, I'm not only talking about the Spanish language, but we also have to talk the language of young people. So we always say no decisions for them without them kind of approaches to things. We have to engage young people, Latinos, into this discussion and ask them those questions of what's going to engage them and increase their access. And to me, I recently had the honor of helping AFSP develop their Talk Saves Lives with Latino Populations curriculum. And we really focused on getting outside of this Western framework of providing services Monday through Friday, 8 to 5. Right? We have to go into communities and we have to be more accessible, just like in the African American and Black communities, going into barbershops, going into churches, going into other community centers that we have access to Latino populations in a more direct manner. And with that, I want to thank you guys. Of course, I'm here to answer any questions at the end of our time as well. And I'll share some of these slides with the organizers so they can get those to you as well. But with that, Ana Chavez, thank you so much.
Thank you so much. Muchas gracias, Dr. Romero. And we will go to our next and final panelist, Dr. Rabadandillo. And here we go.
Great, thank you so much. Wow, what a hard thing to follow, right? These two terrific speakers. I wanted to bring it now to the community level, a little bit, like piggybacking on what Dr. Romero had said in his last intervention. So if I could have the next slide, please. So probably all of us who are here and our community members have heard that the overdose crisis is national, right? But the reality is that the impact is personal. And I wanted to illustrate this by a picture, which really doesn't make it justice because it's hard to really get all of those boards that were planted there on September 2022 in Washington, D.C., and each one of them represents a life lost due to overdose. For me, it's also personal because the slide on the right depicts the picture of my son, Jonathan Deal, who lost his life in 2019 due to an accidental overdose. Next slide. The crisis is such that we are under a public health emergency, and therefore our U.S. Department of Health and Human Services had developed an entire overdose prevention strategy with some of the components that had already been addressed by the previous speakers, primary prevention, harm reduction, evidence-based treatment, and of course, recovery support. Next slide, please. But let's focus on our Hispanic community, right? So something that makes us unique is that we are not a racial group. We are an ethnic group. So we are a community that are united by many things, but also depending on our immigration, whether we are first or third generation, what country we come from, the acculturation level, we may have different needs. However, we have more things that make us come together that brings us apart. And there are not that many studies that are looking really at the opioid and how the knowledge, perceptions, and how the epidemic is really affecting Latino Hispanics. So that's why I am very grateful to have webinars like this so that we start bringing a community and the community voices to address the solutions. We have learned through some of the studies that the Hispanic community need more information because many of us don't make the link by which prescription opioid use can lead to opioid use disorder. And Dr. Fernandez actually had started Dr. Gonzalez had actually started by saying that the opioid crisis started really with overprescription of medication, which is not really the case right now. Right, so we also need to make sure that our families and friends understand how to obtain and use naloxone, particularly those that may have an individual or a friend or a family member with an opioid use disorder. And as it's been really described, the need of having this culturally centered health education program is really key. We need to understand also what are the barriers, right? That makes us unique, or what are those unique barriers for us in the Hispanic community that prevents us from seeking medical, social, and drug treatment services. Although we are talking about the community level, many of the things that affect the community come from policymakers, from decisions makers, from laws that we may have, from policies. So it's important that our voices are united to bring in to the policymakers the importance of cultural factors in providing particularly harm reduction services. And yes, we still need a little bit more of research. And as a researcher, sometimes we get a little bit tired of hearing at the end of every talk, but well, we still need a lot of research. There are certain research that we still need, but we cannot sit around waiting for that research to be completed because the action needs to be now. And we have enough evidence and we still have some guidance that could guide us to making a difference. So yes, we need to understand how distinct contexts and including healthcare and treatment access impact the Latino population, and we are gathering that information. But that should not stop us to start really a movement. And that I think is going to be one of my pledges to all of us. It's not about asking for this. We need to demand that our voices are being heard. We need to demand that our treatments are culturally competent. Next slide, please. I want to bring your attention to this report. This was issued by SAMHSA about a couple of years ago, and this was around the opioid crisis and the Hispanic Latino population, and they call it an urgent issue. And some of the data that Dr. Gonzalez had shown regarding the use of heroin among the 8th and 10th graders comes from this report. At the end of this report, and this is available in both languages on the SAMHSA website, they are suggesting community-informed strategies to address opioid misuse and opioid use disorder in the Hispanic and Latino community. And many of them had already been addressed. Next slide. Without a doubt, what we need, which is, let me say that a lot of this approach is being implemented by other diseases. And as Dr. Gonzalez said, this is a chronic disease and it should not be treated differently than any other diseases and with the same compassion that we treat individuals that may have, let's say, diabetes or cancer. So we do need a community of partners against addiction. We need, as it was said, before by Dr. Romero, we need to really start partnering with schools and the workplace, and the faith-based organizations are critical, and governments and the law enforcement and judiciary bodies, because unfortunately, this is one of the few diseases that puts their patient in jail. So we need to also, our community need to find solutions to figure out how can we help individuals that have this disease to not end up incarcerating. The voices perhaps that are not as loud as they should be are the ones of individuals and families, and particularly patient and family groups. We all know that in other diseases, patient and family groups have really been instrumental for making progress on addressing prevention and treatment of those afflicted by these diseases. Unfortunately, still, our voices, and which ones I include myself, I wear many hats. So obviously, as a person with life experience, our voices are still not heard loud and clear because there's not that many people that openly will discuss the fact that they have someone in their family with a substance use disorder, or that they may have lost someone with a substance use disorder. Next slide. As we are developing opioid prevention strategies at the community level, we need to think about our different audiences. And as Dr. Romero was mentioning, that the public messaging and the campaigns are very important. But we also need to focus on our prescribers. They also need to understand some of the stigma and some of the cultural factors that might involve the population they serve. When we're looking at harm reduction, yes, we do need access to naloxone, but there are other approaches like syringe services programs and safer drug consumption services that have been shown to be effective. So, and as well as other strategies, especially for those individuals that have already experienced an overdose, and especially those that need access to medications for opioid use disorder. Next slide, please. There are already some things, as I was telling you before. I wanted to just very briefly bring your attention to this opioid prevention campaign by Addiction Policy Forum. It is available online. It is available in English and in Spanish and some other languages. It is a terrific campaign. It is free. You can access it for it free. It is focusing on 3 different audiences: the educators, the parents, and also adolescents. How to give them tools and to avoid sometimes the peer pressure that they may have through social media, how it was said before, or just by simply being with other peers that want to have them engage in risky behaviors. Next slide, please. Let's just talk about the elephant in the room, right? It's already been mentioned a couple of times, which is stigma. Because this is a disease that I call the silent killer. It takes over the individual, but it also takes over the families, and it takes over your community. It leads to isolation, it leads to suffering alone, it leads to death. And the reason is because our stigma is embedded in every strata of our society. It starts by the individual themselves, their self-stigma, how they perceive themselves, how do they perceive that the others perceive them. the organizational and interpersonal, the communities, and even the society at large and public policy. So one of the important things that we need to do is to start breaking the silence. And I want to encourage all of you to do that, not those that are here, but also to send that message. This is a disease. We need to break the silence. Next slide. I just wanted to bring you to this, this blog that I wrote a couple of years ago. It was about a year after my son died, on Hispanic Heritage Month, and really trying to bring attention of the importance of our diversity and cultural richness as a Hispanic Latino community. But also one of the things, and I started by saying that we have a lot of things that unite us, right? But some of those things include our perception of drug addiction and substance use disorders, because those are topics that we don't talk much about it. Our lack of understanding is very often, makes us be judgmental and sort of like ashamed. The majority of us don't know that it is a disease, as it's been stated already. And when a loved one has an addiction problem, we tend to either minimize it or we just give up because we believe that recovery is impossible. And it is not impossible. Next slide. So what can we do? And I just don't want to go through this whole slide, but just simply telling you that there are resources. A way that we can start combating the stigma is not only to talk about it, to talk about substance use disorder and addiction as diseases, but also to change the way we talk. We need to really start pushing away words like addict or junkie. Those are very stigmatizing language. The same way that if a toxicology screen result comes negative or positive, we tend to tell that that person is clean or dirty. Those are things that it's already been proven that are very stigmatizing and have a strong impact on the individuals as well as in our society. Next slide, please. I want to leave you with this slide just to tell you that particularly in the last 10 years, I would say, but perhaps more, about 10 years since the epidemic really started, there's a lot of focus on involving communities and figuring it out. How can we start integrating practices, in practices? How can we start integrating prevention and treatment strategies? And at different level, although this is a medical disease, it is touching many parts of our community. And that includes primary care. It includes emergency departments, includes other community settings. So what we are trying to do here through this program, and many of you may have heard about the HEAL initiative. This is the NIH HEAL initiative for this, which is the helping to end addiction long-term. But there is a component of the HEAL initiative that it is focusing on communities. So the Healing Community Study is going exactly to that. And they're funding many groups to look at those best practices for integrating prevention and treatment that can be replicated in communities nationwide, always with the cultural and linguistic lens in mind, especially for our Hispanic Latino population. Next slide. And I'll just leave you here with my, with my contact information. And I really look forward to the dialogue and the discussions in the time that we have left. Thank you.
Thank you, Dr. Rabadandillo, for that great presentation. And we already do have a few questions on the Q&A. And so the first question says, Dr. Gonzalez, are you able to speak more on the specific barrier of decreasing satisfaction with treatment? What does treatment look like? And what type of treatment is recommended to increase satisfaction? Is an issue of language, cultural context?
Thank you very much. This is a great question because it brings to acquaintance treatment, which is, a foundation for recovery and advance into and return to a productive life in all means. Treatment, we all know, needs to be individualized. Treatment needs to be designed person by person. Can be different, can be sometimes the same, but treatment needs to be individualized. We need to consider the rest of factors that are going to be affecting the progress and the result of the treatment. And of course, culture was mentioned. And yes, culture, traditions, values, beliefs, need to be learned and considered when establishing treatment. I think that still we have in many parts, many areas, a cultural mismatch between the individuals seeking for health care and the health services. There's a mismatch, and this contributes tremendously to the results and satisfaction of the treatment. It is other protective factors that already have been presented by Dr. Ravadan and Dr. Romero that also are needed to be included in treatment. So yes, there are many factors that can affect satisfaction and results of a treatment, and all of that protective factors, all of them need to be based on the values and the beliefs and practices of the Hispanics and Latin that are seeking for treatment and of course looking for recovery.
Thank you, Dr. Gonzalez. And I am wondering if either Dr. Romero or Dr. Rabarandil would also like to answer or add to the response given by Dr. Gonzalez.
Yeah, so I can just jump in. So I concur with everything that you said. I mean, I think that the fact, so treatment has to be personalized, but it's also very complex, and it's not sometimes with some of the other diseases where you have a clear course of action as far as the treatment. The treatment has to be changed according to the progression of the individual patient. So it's not that you prescribe a certain practice of what you're supposed to do, and then you follow that for years to come. That going back and forth and trying to understand where you are in the path for recovery is also very important, and who are the different stakeholders. I think that you, Fernando, were bringing a very interesting issue as far as that you call it a mismatch, right, between what we are expecting versus what the availability of services. But I think that it's also, there's a mismatch perhaps about the expectations from the patient's perspective of what, the path for recovery or a particular treatment may look like, not realizing that this is a lifelong, this is, as you said at the beginning, a chronic disease, right? And as with any chronic disease, you are going to have to live with it. It's one of those diseases that, similar to others, it's frequent that individuals relapse, right? And we shouldn't be looking at this as a failure. People also relapse sometimes on taking their blood pressure medication, for example. Also a disease, it's a condition, blood pressure, that it is very difficult to manage sometimes, or diabetes. So I think that the expectations come from both ends, and that's why it is so important that, going back to Dr. Romero's comments on doing the education and using multimedia campaigns. We need to educate our individuals to empower them to be part, also active members of that solution, not to just sit there passively and say, okay, now you need to give me the treatment. They need to advocate for themselves. And the only way they'll be able to do that is through knowledge and power.
Thank you, Dr. Rabadandil. Dr. Romero, would you like to add?
Yeah, Anna, if you don't mind, just briefly, I just want to echo, and I think our other two panelists said this really well in the sense of kind of me trying to summarize a little bit, is that, a behavioral health crisis and a behavioral health substance use situation deserves a behavioral health response, right? Not a suppression response, not an incarceration response, as Dr. Rabadandil mentioned. We have to get out of this putting people in jail and in prison for a substance use disorder. And I think another element that I really feel, and I've been talking a lot about this lately from some of my doctoral research and studies, is really taking the glean off of the individual for their failures in substance use programs and seeing what is the reason that maybe the system is causing them to fail or to not succeed or not to have successful outcomes as well. And sometimes when we take the glean or the examination off of the individual, we look at it from a systems lens of saying, how are we creating barriers to access? How are we creating more stigma, even with the way that we approach things in our treatment and in our service delivery, right? So I think that us also examining for Latino populations in particular that have a history of immigration, first, second, third generation individuals, I think we also have to look at this through what is their experiences with discrimination and racism that is causing them to gravitate towards self-soothing and substance use and alcohol use, because we know that many studies show that individuals before they immigrated to the United States, unfortunately, were otherwise healthy in many respects. And when they immigrate to this country, they start to become unhealthy in many respects, as Dr. Gonzalez mentioned, not just mental health wise, but also medical conditions as well. And, that has a lot to do, obviously, with other factors, food and access to quality food and other things. But I'll end with that, Anna, so we can maybe take a couple more questions. Thank you.
Thank you, Dr. Romero. And before I continue with our questions that we have in our Q&A box, I would like to let our participants know that if you feel more comfortable asking your question in Spanish, you are welcome to do that. Si algún participante quiere hacer su pregunta en español, también puede hacer eso. Si le gusta, y la puede poner en la pregunta y respuesta. Okay, so we'll move on. The next question. It says, I support in naloxone presentation training, and we often get the question from the audience about support for surviving families. What support systems are available for surviving family members? Are there national hotlines, national counseling groups? And whoever would like to tackle this question first, and we'll move down the other panelists as well.
I don't mind jumping in there just a little bit. Like I mentioned, one of the national policy efforts that the American Foundation for Suicide Prevention is really pushing and asking for a continued funding for $836 million from the federal government is to continue to sustain the initial effort of 988. And I think today is the 1-year anniversary of rolling out that initiative. And they've already seen, and I'll speak for New Mexico in particular, we've already seen 100% increase in people reaching out for mental health crisis. And then on the adolescent side, we've seen a 50% increase of individuals reaching out for services. So I think it goes to all of the points that were made today around language and access and appropriate marketing of messaging for Latino populations. And that's one that I'll just share with you all. Please keep in mind, 988 is now a national hotline that you can reach, and they will connect you to somebody, in your community. Is what they're trying to do in most cases, if there are those services in your state and in your community as well. But Thank you, Ana.
Thank you, Dr. Romero. Dr. Rabadandil, Dr. Gonzalez, anything to add?
Yeah, I could add that maybe within the context, not so much on suicide, but on substance use and opioid overdose and death, right, or survival families. I think that you see, as Dr. Gonzalez was mentioning on the trajectory of the epidemic, it started with prescription use and then it moved to heroin, right? And just by mentioning the word heroin, people take a step back because those are major substances that we are talking about. And now it's fentanyl, right? So the fact that a lot of the deaths currently, the cause, about 2/3 of the deaths are really due to synthetic opioids, mostly fentanyl, is because fentanyl is now an adulterant on many, many drugs. So it's not only, and I think that that's something that we need to keep in mind. It's not only about, heroin or even marijuana in some cases, but also pills, counterfeit pills, right? So when an individual, and I can tell you by personal experience, but also by interacting with community of family members who've lost someone due to an accidental overdose, the stigma that we've been talking about, it's very, very strong. So as far as I know, there's really not a national support for families of survivors, that have been impacted by this epidemic. There are local groups and there are some national groups that are being very active on trying to raise awareness about the importance of fentanyl and educating our communities. But as far as the support to the families, that is an area where we really need to start putting a lot of attention because, when someone dies of a stigmatized disease like drug use, it's a different story as far as how the community reacts. It's also their own personal stigma of how much they want to share with that. I think that if something has shown something that COVID-19 pandemic shown us is the importance of mental health, right? So I think that there are now a better understanding of the importance of mental health conditions, but it's still drug use is a different way. So I can tell you by interacting with, I do belong to a group of families, in particular mothers who have lost a child to overdose. And it's very helpful in many cases because that stigma continues. My son died 4 years ago. And while I am a health professional and I am by no means ashamed of my son, because this was an accident, I think that that's the first thing that we need to install that sentiment in our family members. If your child has a substance use disorder, it's because they're sick. So no one is really ashamed of a loved one that has diabetes or asthma. But still, it is hard. It is hard to, when they learn, that me or other people that I know, that you have lost a child and they said, oh, was it an accident? That's the first thing. That was a car accident because my son was 28. So then I said, no, it was a substance use disorder. It was fentanyl. You can already tell, how people react. So I think that we sometimes tend to neglect the people that are left behind. I am all for prevention and I'm all for treatment. And I am a champion for those that have the courage to be in recovery. And we keep talking about people with lived experiences. And I want to make a pledge that those ones that have experienced a loss due to a substance use disorder also have a voice because they have the lived experience, sometimes of decades, of dealing with someone with that disease.
Thank you, Dr. Rabadandil. Dr. Gonzalez.
Yes. Am I on mute?
We can hear you, sir.
Okay. Well, thank you. Thank you, Dr. Romero, Dr. Rabadan. You presented a great spectrum of resources that can be accessed in regarding of families that have been affected by a loss of a dear one. This is part of what we need to consider, and we need to start and continue working in our communities. Already, Dr. Rabadan presented the community groups that are being organized. Those are great. At the same time, the agencies regarding mental health and recovery of families are growing. In my community, in my region, one of the agencies received a multi-millions grant to support this type of situation, among other mental illness situations. And I have I've seen the growth of these groups in bringing politicians, policymakers, even federal judges and federal employees and federal agencies like the Drug Enforcement Agency. And all of them participated and offered support to these groups. It was a great meeting, a lot of motivation, and everybody, got a piece of it. And I think that they are, well, I'm sure they're continue their great work. They are growing, but it's about community enforcement, community empowerment.
Thank you, Dr. Gonzalez, for that. As we're talking about resources in communities, I'll make a couple of announcements before I go to our next question. And Marisol Oropesa says, my agency has a helpline for youth and anyone in parenting role. We also have support groups for parents and youth, Parents Anonymous. Parents and youth can call, text, and support. Chat at 855-48-PARENT or 1-855-427-2736 for emotional support and referrals in English, Spanish, and other languages every day from 8 a.m. to 8 p.m. Thank you for that, Marisol. And Gail Nazarene says, I work at Esperanza Health Center. We have a MAT harm reduction program that is in an underserved area. 60% of our patients are Hispanic and primarily Spanish speaking. We have a successful MAT program. Our entire MAT team and medical providers are all bilingual. Our program addresses the cultural bias issues and ethnically appropriate for our Hispanic population. Thank you for that, Gail. Our next question is, do you know any groups or organizations that are doing this well? What is working in their community or their successes with outreach, education, or stigma reduction? And I think I'm already giving some organizations that are providing some great services. But any of our panelists have anything else to add to that?
I can tell you there is, so I live in the Washington, D.C. area, but technically in the state of Maryland. And I work very closely with a community-based organization called Identity that primarily focuses on underserved adolescents and families. The majority of them are Hispanics. And what I've noticed is that they take that approach, that multi-sectorial approach. So they work a lot with, particularly with the schools. And I think that while I recognize that substance use disorder can really affect all ages, I mean, we've seen that through the pandemic, particularly in our elderly population and over medication, et cetera, et cetera. The most vulnerable times on developing a substance use disorder and addiction are during those adolescent years. But also for many of our families, the school is an entry point to their community. That's where a lot of the friendships are created, a lot of the sports, faith-based organizations, for example. So that particular organization that I work with takes this multi-sectorial approach where they are working with the communities, but at the same time, they are working with local governments, right? So some of the local governments are the ones in charge of, for example, summer camps, right? Or community sports leagues for adolescents. So being able to be interconnected in that way has been shown to be very effective. And my last comment will be that we should be focusing a lot, in my opinion, on faith-based organizations. I have been involved in talking with some of the faith-based community leaders and it is in their community look at them sometimes for advice and comfort, and we should be working with them to give them enough materials so that they themselves know how to help their community, because sometimes our Hispanic Latino community prefer to go to a spiritual leader that go to a health professional. So that's another entry point, as Dr. Romero was mentioning about the barbershops that had been a tremendous success in health, particularly with the African-American community. I think that we have an opportunity, particularly with our faith leaders.
Thank you
And-
for that, Dr. Rapandillo. I see Dr. Romero's has his hand, and then we'll go to you, Dr. Gonzalez.
Absolutely, yes, sir. Dr.
Thank you so much, Ana and Dr. Gonzalez. I would just want to mention 3 programs that are local to New Mexico. One is a adolescent program that was started after a Jennifer Weiss lost her son to an opioid overdose, and she became a huge advocate in the community and has recently started, well, it's been probably 8 years now, I want to say, Serenity Mesa, which what she did is not only leverage local county officials to get local funds and state funds, but she's also working through, in New Mexico, we're very fortunate last year, well, no, it's been 4 years now, I guess, they passed the behavioral health tax in Bernalillo County, which a percentage of every person's sales tax goes to behavioral health programming, which generates usually about $20 million annually now for behavioral health services in Bernalillo County. So that's one program that's really leveraged county funding and local state dollars. OI recovery, which OI Today Recovery stands for, they actually represent more of the adult specific approach, but what they've done is they've integrated evidence-based modeling, specifically the matrix model in IOPs is what the model that they utilize. They also are utilizing seeking safety and other substance use and trauma specific models, but theirs is a residential treatment center inpatient where they also integrate cultural elements like horticulturing and farming and other things that creates kind of a cultural connection for people. And that seems to be very successful. And then lastly, Bernalillo County, they have the Department of Behavioral Health Services. The Care Campus is a campus that is supposed to be in their description a curbside drop-off for detox. They have a medical detox, which they partner with the University of New Mexico, and then they have a transitional housing program and mental health and substance use program before that transitional housing program. So basically a continuum of care built into one campus, where if a client goes through that program, they basically can go from detox to transitional housing, within around a year if they're successful in their completion. So those are just 3 local programs here in Albuquerque region or area that we kind of look at as, I think, potentially setting some standards for quality of care in our state as well. Thank you.
Thank you, Dr. Romero. I know, Dr. Gonzalez, you had some comments, and then we'll go back to Dr. Rapandillo.
Yes, thank you. Well, in my region, we have implemented this program on overdose rapid response and prevention. So first of all, we came and did a situational diagnosis, analysis of resources in our community. At first, mostly oriented to substance use disorder specialized agencies, and we are continuing to include mental health services. Our basic workforce for the program are peers, specialized peers. Training, sensitive, highly sensitive to the problem. They have been and they have passed through the ordeal of substance use and mental use disorders. And they do a fantastic work in the community. They know the problem. They know the language. They know how to refer. So as soon as they establish contact with a person, being affected by substance use disorders or mental, immediately they establish or they present a referral to agencies, specific agencies or specific services to start the process of treatment. Also, during that process, they offer and they move very fast in offering other social services to them. Housing, jobs, you name it. If any documentation has been lost, start the process to getting the ID information of them or services, etc. And of course, they provide them all the available resources to each one of the individuals that they get in contact. I think that still a long way, but with that, I think we are servicing very effectively and efficiently the persons that we are finding in our community.
Thank you, Dr. Gonzalez. Dr. Ravanandillo.
Yeah, I wanted to bring up a stakeholder that perhaps sometimes is not in the mind of everyone when we think about communities, and these are community colleges. So I just want to share a little bit about my experience with that. My son, Jonathan, the one who passed away, started his academic career in a community college, in Montgomery College here. And then he graduated and went to a 4-year college. When we wanted to establish a scholarship in his community college for in his name, and when his academic advisor learned about his passing and his and the cause of his passing, he was troubled by 3 days. He said, "I couldn't sleep, Christina, for 3 days because I keep thinking, if I had known, how that he had this disease, if I had been able to recognize the symptoms." So that it's a long trajectory, but today, actually this month, Montgomery College is starting a training on substance use disorders to all of the personnel that is associated with Montgomery College in English and in Spanish. It is a mandatory training. And when I start thinking about that, it makes a lot of sense, right? Because when we think about schools, we focus a lot on, K through 12, particularly high school, I think, right? But we forget, the importance of community college and the importance of the people that are there in that community. And many of our Hispanic Latino population has their first entry to higher education through community colleges. So it's not only about educating our communities, our families, and through faith-based leaders, but also looking at academic institutions to train everyone so that they can actually be able in the classroom perhaps identify what might be potential signs of a substance use disorder. And I'll be happy to share with anyone the experience of how I started partnering with Montgomery College and how now almost 800 people in Montgomery College in 3 campuses are going to be trained every year on substance use disorders.
Oh, that is excellent. Thank you for that, Dr. Ravanandillo. And I think we have time for one final question. And I am going to go ahead and I'm going to take one of our I have 2 raised hands, so I'm going to take a question from one of those folks. If the other person that has their hand raised can please put their question in the chat, we would appreciate it. So Marisela Ramos, if you want to ask your question, you may unmute yourself and ask your question to the panelists.
Or maybe possibly write it in the chat because we are running a little bit close on time so
okay.
if Marisela and Gloria, if you could all write your questions in the chat, and then we'll definitely have the panelists reach out to you with a formal answer. So thank you.
Thank you for that, Dr. Villalobos. And so I'm going to now hand it over for a summary to Dr. Ravanandillo. The floor is yours.
Yeah, you made it very, very hard because we had a fantastic almost hour and a half, right, with a lot of information. But I just wanted to bring us all back, right, after having the opportunity to listen primarily to us, right, and also a lot of very active conversations and wonderful resources that had been put in the chat. I wanted to just reflect a little bit about what we have learned, some of the things that have hit home for some of us, and particularly for me, right? So I think that one of the most important concepts is that substance use disorder is a disease and it's not a lack of character. And we really need to start socializing that. We have learned that it's also complex, but it is treatable. And we learned also what was the origin, right? That even though it started as prescription medications, currently, the magnitude of the problem lies primarily in synthetic opioids, such as the appearance of fentanyl as an adulterant, still primarily. That we also have learned that the experience with substance use disorders is different, right? And it depends sometimes on the racial and ethnic background and what are your experiences as a person. So the issue that Dr. Romero had brought up as far as discrimination, right, and racism cannot be ignored. We've heard about numbers and the magnitude of the problem of how we have about 6.2 million people, Hispanics, that are affected by a substance use disorder, but only those that were diagnosed, only 94 only really, it was like what, 7% of those really received treatment, even though they needed it. And we have heard also about their perception, right? That many Hispanics are less successful with treatment modalities. They have lower satisfaction with treatment, and they even have shorter stays in substance use disorders. We've heard a lot about the importance of having an integrative approach from Dr. Romero, right? I mean, how it's important also to have a multifactorial and many other things, like, for example, pushing a more adaptation of gun safes and locks, right? We need more advocacy in that respect. Using 988, right, which is a national crisis helpline that has been already, we know we have data for the last year, but that is something that you could actually access, and you will have someone who speaks Spanish in case English is not your first language. The importance of multimedia strategy campaigns and that school-based engagement that we'll be talking about that. An interesting aspect about how we look at machismo, right? And the two different components of machismo, how we see the breadwinner, the person who takes care of their family, versus that violent figure that might come, with a criminal aspect, which really is not quite true, but that is how it is depicted in many cases about the association of particularly male Hispanics. And how that opioid epidemic is affecting families and how it is bringing it to the personal level, and how stigma plays such an important role. The differences, whether you are first generation, how acculturation is also playing into the way that you may be, affecting your health. And that is something very much known, and the importance also of bringing in communities of faith, communities of bringing the peer-to-peer model, as Dr. Gonzalez was mentioning, and how all of this needs to involve families and communities at large, and making those bridges, that what happens at the community level has an implication to the local and at the national level, and how we need to involve policymakers in the solution. But at the end of the day, knowledge is power, and the mobilization of our community needs to raise their voices to demand that our needs are really met, and that it have to be done under that cultural and linguistic lens, taking into account that we are a very diverse and rich community, and that depending on the community that you live, some of those solutions may need to be adapted to the realities of your community. And that's what I've heard, and I don't know whether some of my other panelists, would like to add something that I missed, but that's my take-home messages.
Well, thank you for that summary, Dr. Robert Ondale. I think in looking at some of the chat and some of the responses to your presentations, we should have had more than 90 minutes to talk to all three of you, because your expertise, knowledge, and your empathy for the crisis that our Hispanic and Latino families and communities are under right now is in dire need of solutions. We don't need any more barriers. We have enough challenges. We just need to come together as a community and fulfill some of the promises that we made in behavioral health solutions. I want to allow, we do have a few minutes. I want to allow Dr. Fernando Gonzalez and also Dr. Rocky Romero to take us through our final few minutes. Any final words? I have added, for those of you that are still online, please complete our evaluation form. For us to be able to present these types of presentations, we need these evaluation forms to show our SAMHSA leadership that we still want to continue to have these types of conversations, and they're strongly needed. So please complete the evaluation form, and you will also receive your certificate of completion. So I'll go to you first, Dr. Rocky Romero, for your final words and taking us home. We have about 5 minutes left, and then I'll allow Dr. Fernando Gonzalez. So thank you.
Yeah, first, thank you to our host, the National Addiction Technology Transfer Center and Prevention Technology Transfer Center. And thank you to my colleagues for spending some time with me. I just want to reiterate, and it's been said, you all are the voice that can advocate for quality, culturally sensitive services in your community. And it means starting to maybe reach out to your senators, to your legislators, especially those of you that are providers. Get involved in the advocacy work of prevention, intervention, and treatment for Latino populations. They depend on you to hear your voice. And we can do this in pockets, or we can join in on a national voice movement to change things and change the way we treat people. I think for some aspects, we forget that we also have to teach people how to provide good customer service, right? That's not something that we teach a lot in our colleges and our universities around quality care. So thank you for your time. Thanks for allowing me to spend some time with you. Dr. Gonzalez?
Yes, thank you very much. Well, I don't want to be repetitive. I think Dr. Rabada and Dr. Romero have completed the circle. Maybe what I can think about is, and I'm going to be reiterative on some issues, is to implement or try to implement comprehensive holistic services. Utilize schools linked to primary health care, bring all the services available to this very, very affected population that is living in our community, and we want them back in the workforce, into the families, into the friendship that we have with them. We need them. So let's put our best effort at all levels, bringing community resources into a better way to deal with this issue, and how to be better public servants and private and providers to our community.
Yes, thank you, Dr. Gonzalez. I think one thing that we probably didn't have time to touch on is workforce development. I know in the chat, we definitely need counselors. We need individuals who look like us, who speak like us, and not only at the community level, but in SAMHSA leadership, at the NIH leadership. They need to know the issues from our perspective, not from somebody on the outside looking in. And I think that has always been an issue. So again, a thank you to all of our panelists, to my team, the ATTC, and to the PTTC. I so appreciate you taking the time out of your busy schedules, because we know how busy we all are, to have this conversation. And I hope we can do it again. We'll probably have to have a part 2 from the response that we've had in the chat and from the emails that I'm receiving. So thank you again. And I wish you all a wonderful afternoon. And again, please, if you have an opportunity, fill out the evaluation form so that we can have these types of conversations moving forward. So adios, gracias. Thank you very much. Goodbye.
Adiós, buenas tardes, gracias.
Bye-bye. Gracias.
Bye.